the rest is history, so to speak. I mean, it changed his life. It was like night and day. He went from having hundreds of seizures. After about 2 months, he went 17 days with no seizures, and then he just got better and better.
Hi, everyone, and welcome back to Harmonia Podcast. Today, we are joined by the beautiful Hannah Deacon, who has an absolutely incredible story. And before we get into it, I would just like to introduce Hannah. Hi, Hannah. Welcome.
Hi there. Thank you for asking me to be on.
No worries at all. I mean, with such an incredible story, I just felt like it was something that was extremely important for people within the industry and people outside of the industry who are considering medical cannabis as a viable alternative to conventional methods. I think your story is just amazing, and thank you so much for coming on here and sharing it with us.
Pleasure.
Would you like to give yourself a little bit of an introduction before we get started?
Yeah. So my name is Hannah Deacon. I started off as a campaigner because of my son Alfie, who has very severe epilepsy caused by a gene mutation called PCDH19. And I would call myself an accidental campaigner. I didn't want to be a campaigner, but I was forced to do it to help save his life. And since then, I continue to campaign, but I've also moved into working within the industry to try and make it doctor and patient focused, which is something I feel really passionately about.
Yeah, that sounds amazing. Thank you very much. Would you like to tell us more about your son's journey and your journey into accidentally advocating for medical cannabis?
Yeah, very happy to. He was born very well and then got very poorly at 8 months old and ended up on a life support machine. And we were in hospital, me and his dad, with him for 4 months, which was absolutely horrendous and, the worst thing I've ever been through, hugely traumatic. And we were very lucky that he didn't die, putting it plainly. But we found that the only thing that worked for him at that point was intravenous steroids. So intravenous steroids basically reduce inflammation, and alongside antiepileptics, they seem to work and stop his seizures. So we were very lucky to take him home. But he'd lost every skill, so he couldn't sit, he couldn't drink or eat or anything, he couldn't babble. And before he had his seizures, he was reaching his milestones. So it was very difficult. And we worked on rehabilitating him for about 4 months, and then it happened again. So he doesn't have seizures every day, but what he has is very severe, what is called clustering epilepsy. So it's where seizures come in one big bunch and there's lots and lots of them, and without medical intervention they don't stop. So they're very, very, very dangerous. And he carried on like that, and I became a full-time carer. There was just no way I could work and look after him, which was obviously very challenging for me as well, because I'd been brought up to work and I wanted to work, and as a woman I wanted to go out and work and have my own money and things like that. So it was that was a big challenge to move to being a full-time carer as well. That was very hard, but obviously most importantly, seeing my son suffer so much was absolutely horrendous. And as he got older, he just got worse. So by the time he was 4, he was in hospital every 3 weeks. And by the time he was 5, it was every week. So in 2016, he was in hospital 48 times, to put it into context. So it was very, very, very hard and very traumatic. My partner was working all hours he could to keep a roof over our head. We actually had a daughter when Alfie was 3. Before he got really bad. And that, was wonderful. And I'm so blessed every day that I had her, because actually I had a very, very positive experience mothering her, and she's very healthy. But it was obviously another thing added to a very difficult situation. So yeah, he just got worse and worse. And then at 5, we were told he had PCDH19, and I don't have the mutation, and nor does his father. So we were waiting for the doctor to say, oh, this is the treatment, this is what we do. And actually he said completely opposite. He said, let's firefight, let's hope he gets better with age. But actually there's no research. At the point he was diagnosed, he was one of 5 boys in the world with that diagnosis. He's now one of 9. So there's no research into his condition specifically for boys, because it, crudely doesn't make anyone money. So there's no research. So it was very, very challenging for us to have that diagnosis. And actually at that point, that's when I got very, very depressed and very anxious and very worried about our future. I didn't want to watch my son die. I didn't want to be a carer for the rest of my life. And it was very, very mentally traumatizing, I think, for all of us. But mostly, as I say, to see my son go through what he was going through, and he didn't have a quality of life. He had a very, very poor quality of life. And as a parent, that's all you want, is for your child to have a happy life. And he didn't have a quality of life. It was never about the fact that he had a disability or he had epilepsy. That's fine. We can learn about it. We can deal with it. It was the fact that he had no quality of life. So when we knew that there was no treatment, I just started to think, well, what do steroids do? They're anti-inflammatory. And I thought, is there something in the world that could treat him that was more natural and didn't cause the side effects? Because we were told if he carried on having 25 doses of steroids a month, which is what he was doing intravenously, that he would probably get heart failure or kidney or liver failure. It will kill you eventually. You can't have that many steroids and survive it. But also the side effects were horrendous. He had psychotic events. He was hitting, kicking me, punching me, all of those things. And that is incredibly hard, again, to have a little 6-year-old boy, someone you love more than anything in the world, punching you in the face and kicking you all the time. It was very, very, very hard. So that was sort of the catalyst to go, right, I've got to do something. I've got to make change, because actually no one's coming to save us. I came across cannabis. I thought cannabis was a recreational drug. At the point of doing that research, I was always, people smoked it at college and university, and that was about it. That's what I knew of it. I didn't have a particular sort of bad vibe about cannabis or anything like that. I just didn't think it was a medicine. I did a lot of research. I spoke to a lot of families. I remember seeing David Nutt doing a video on YouTube about the endocannabinoid system. And I just thought, this is something that's really interesting. I talked to Alfie's doctor about it. He wasn't that keen, but he said, there's a drug called Epidiolex you might be able to try on trial, which is a CBD-only drug, which is now licensed for 2 conditions on the NHS. But we couldn't get on that trial because Alfie didn't have those conditions. So that's when in 2017 we decided to move to Holland. We did that, and we spent 6 months there working with a paediatric neurologist, and Alfie just got prescribed whole plant cannabis with CBD and THC, and the rest is history, so to speak. I mean, it changed his life. It was like night and day. He went from having hundreds of seizures. After about 2 months, he went 17 days with no seizures, and then he just got better and better. We then had to run a campaign in the UK. My partner and I didn't want to live in Holland for the rest of our lives. We still have a child with complex needs and with support needs, and we needed our family and our friends. So we came home in February 18, made the very difficult decision to remove Alfie from the medication. And we did that, and we got home, and we worked with a political lobbyist called Peter Carroll, who helped us to run a campaign, basically. And as I say, I'm an accidental campaigner. I think it's something that I found that I could do, and I felt so passionate about it. If it had been for me, I'd never have done it. I really do take my hat off to people who advocate for themselves, because I've never been very good at that. But when I was advocating for my child, I found the lioness in me, and I didn't want to stop until he was safe, until he had this medication. We were offered Epidiolex by the Home Office, and we were just said no. I mean, obviously it was a Home Office issue, because it's not a medical issue at that point. It was an illegal drug. It was a Home Office issue. We had meetings with the Home Office. We then had a meeting with Theresa May, the then Prime Minister, who agreed for a licence to be applied for, a Schedule 1 licence, which is what the doctor needed to prescribe for Alfie. Unfortunately, our NHS doctor, even though he was very supportive, was told he couldn't help us within the NHS. Our GP could, so we have a very good GP, and he's always supported us. But that's how we met Professor Mike Barnes. So he stepped forward very kindly and offered to do that licence, and spent 3 months doing that licence, actually not knowing how to really do it, because it wasn't a company applying for it. It wasn't research, it was a doctor. I think the Home Office didn't really know how to do it either, that it was very difficult. But I kept quiet at that point. I agreed with the Home Office not to seek media attention, because they were doing what I wanted. And actually, I felt really importantly that the way you make change is to work with people. It is to try and find a common ground. It's not to force people into doing things. It's to try and work with them. And I felt we were doing that with the Home Office. So for me, it was really... Sorry, my printer's just started going for some reason. I have no idea why. So we decided that we would work with the Home Office and not sort of force them to do anything. But unfortunately, 3 months in, they said to us, "Oh, we don't know. We don't know if we can give you this license." So that's when I did do some media work, and we got that license on the 19th of June. And Alfie's had a prescription ever since. And actually just coming up to 4 years seizure-free. Mike Barnes did a lot of work behind the scenes with them as well. But we got to June 18 and we were told that the application wasn't full enough, that it hadn't got everything they needed. And that was very difficult because my son was very poorly at that point again because he'd had the medication removed from him. So I did an interview then, so I went on to Radio 4 on the 19th of June 2018, and that day we were given the licence by the Home Office. So Mike and my GP were prescribed for Alfie, and we brought the medication into the country, London City Airport, on the 4th of July. So that was the first time that the medical cannabis had been brought into the UK legally. And it was amazing. But as I say, it was sort of all forced upon us. But I am so grateful every single day that we fought for Alfie as we did. And I think what pushed me to do it so much was the thought of him dying without actually trying everything. That I didn't want to feel that guilt. I mean, any parent will know that whether if your child's well, you feel guilt every day because you want to be the best you can be. And sometimes that doesn't feel like you are being that. But when they're very poorly, it brings a lot of guilt and a lot of what ifs, and what if I did this differently? What if I did that differently? So it really was about me just knowing that I had to, and we had to as a family, do everything we could to help him to live a better life and to live a life that was worth living. And also for me, I wanted to work, I wanted to have my own money, I wanted to do all those things that, a lot of people take for granted. And actually, I have no regrets because it's the best thing we ever did. And Alfie is, we're doing so well, and nearly 4 years seizure free, which is amazing. He's had no hospital admissions, nothing. Which have caused him so much trauma. I mean, he does not do hospitals or doctors or anyone, to be honest, because of what he's going through. So, we feel very much that we've given him the best opportunity at life at the moment. And I can't say that will last forever. I don't know. He has a very severe condition still. We don't know whether puberty will bring change or whatever. But at the moment, he is a very healthy, happy boy. And, so... And really, at that point, we were just fighting for Alfie. And obviously, in the back of my head, I always thought, I hope this helps other people. But we were always advised never to talk about other people, because I think that's right. The government would have just been like, nah, if we just said, we need to legalise cannabis for everyone to have it as medication. I don't think that would have gone down very well. So we always very much focused on Alfie's campaign. But I do feel very blessed that we were part of something that and I hope has helped a lot of people, because that's, for me, brings a lot of comfort. That is actually a lot of grief around having a child with a disability, a huge amount of grief, something you'll never get over. It's something that's very hard to deal with. So it is lovely to think that his story has helped a lot of other people. That means a lot to me.
No, and I mean, it's absolutely fantastic. I mean, firstly, I would like to say thank you so much for sharing that with us. I mean, even for myself, just listening to that brought a little bit of tears to my eyes. Because it's very heartbreaking to see somebody in such a level of distress and trying to get medical treatment that isn't necessarily effective. And so I can completely understand what you must have been going through. Actually, no, I can't. I don't think I could ever understand, actually, if I'm going to be honest. I was like,
you can sympathise, and people do, we appreciate people. That's all you can do. I mean, I'm very, very honest about it. I can't understand what it's like to be a patient in pain, or to be a patient myself. I'm not a patient myself. I'm the parent of a patient. That's different. I think all we can do is to be empathetic to each other and being kind to each other, because I do think in times gone past there has been a bit of judgment in the industry and in the patient community around, who's got it best or easier or everything. And it just simply isn't. It's just different. Everyone's got different situations. Everyone's got different needs. Yeah. And actually the way we move forward together is really respecting those different positions. Like, children need prescriptions. That's it. They need clinical oversight. But there's a lot of patients that use medicinal cannabis that probably don't need that full clinical oversight, that can choose medicine that works for them. Children with disabilities or people with disabilities can't necessarily do that. And I think we have to create an industry that serves everyone, not just a small part of it, because actually then it's not fair, and actually for me, most importantly, we need to get prescriptions right, because actually for children with disabilities or for people with disabilities who are going to be in care for the rest of their lives or who are going to need continuous hospital treatment, those people can't benefit from medical cannabis without prescribers. So we have to get prescribing of medical cannabis right first, before we push for other ways of accessing cannabis as medicine. And I feel very strongly about that, because I think those people we need to advocate for first, really.
Yeah, I mean, you mentioned two things that are very important, and I think that I just want to touch on one of them because I do mirror the same. I feel a lot like the industry does sort of focus on a certain criteria, and I think we often forget that this is medication, and medication applies to anybody who meets the criteria for the medication. It shouldn't just be a handful of people that we target. It should be every single person that requires this medication. We need to be able to make it accessible for them. And the second point is, yes, I fully agree as well, is that we really need to get better at prescribing. I mean, I'm forever screaming about a treatment model, and I know it takes time for us to get to that point. But I know that when we start moving certain things into place, in particular, I think supply chain, I think, would be the biggest one, because I know, like, my do rely on the medication on a regular basis. On a daily basis. Supply chain is it's a problem. Often 2 or 3 weeks later, by the time I've reached day 10, my health has completely declined. So by the time I do get my medication, I'm now having to start back from scratch again and pick myself back up, get back into my routine again. Like, it is a bit of a setback.
I completely agree with that, and that's even more paramount for children with epilepsy. We have a big problem in the sector for children with epilepsy, and the supply chain. And actually, a child running out of oil could mean death. That's it. Yeah. Not a recurrence of symptoms, but actually death. And that's something that I feel very, very strongly about. That if any company brings product to supply to the market, it has to have a very, very robust supply chain. And I don't think that's happened in the past. I think it's getting better, but that hasn't happened in the past. And I do agree with you as well. There has been, I think, a focus on moving illegal users into the legal market, which is something that's important. People should not be criminalised for medical use of cannabis. But it's so short-sighted as well. We have hundreds of thousands of people in this country who don't know cannabis is legal, who aren't interested in cannabis, who don't care about cannabis, but actually are in pain or have psychiatry issues or have epilepsy. And I think we very much need to make it about the medical value of cannabis, rather than, there are people that know what they want and know the products they like, but actually they're in a minority. There's a huge amount of people out there that just need effective treatments for their conditions, and those people are who we need to be targeting, and that's how we build the industry, rather than targeting a small amount of people in the greater scheme of things. We need to be looking at naive patients, basically, and people that just want to feel better. And I do think which we will see, companies bringing out new ways of delivering cannabis to people, so i.e. patches, suppositories, pessaries, creams, and nebulizers, things like that, where people will actually be getting the benefit of cannabis, but through a much more medical form. People will feel more comfortable with it, and that's again how we build the awareness of cannabis as medicine, but also reduce that stigma, because people people will feel uncomfortable about people using cannabis flower in vaporizers. That's something that they, a lot of people that use that shouldn't, they shouldn't feel uncomfortable. They shouldn't feel worried about using that in public. But the fact of the matter is that the whole population have been told cannabis is bad for the last 75 years. It's not going to be something that's going to change overnight. So yes, we've got to build awareness. People should use their medicine however they want, wherever they want, and feel safe to do that. But the other way that we reduce that that stigma and judgment is by bringing out different ways of delivering cannabis. So it's much more targeted, but also maybe more medical. So it makes people feel, like little old ladies with back pain aren't going to be vaping flower, and those people shouldn't be not able to access this medicine. They should be able to access it. And that's why we need new delivery forms to be able to make those patients feel comfortable with it.
And Hannah, I fully agree. Like myself, I do use the vape, and I know I shouldn't, but I do feel uncomfortable.
Yeah.
I do feel uncomfortable going outside, vaping at the bus stop. Like, I'll still do it because
judgment, and you shouldn't be judged at all. No, because people have been told that cannabis is bad for so long, and that's the problem. It's about education and talking to people. If people feel uncomfortable talking to them, but I completely agree with you. When you've got a condition, the last thing you should be doing is then trying to persuade people around you that it's appropriate for you to do what you're doing. That's just not fair. But it is a reality, which is why we have to build public awareness to get people to be more understanding. Exactly,
especially if you're using the medication the correct form as well, because as you're aware, there are a lot of people who do generally tend to just put it into a joint, which is illegal, by the way. Just to be very clear, it's highly illegal. You need to use it in the vape pen, and also you're destroying the medicine when you actually put it into a joint, because you're now burning it. You are no longer that is already explained in a different podcast, but anyways, it's illegal.
It is illegal, and I actually think it's hugely unhelpful. I've seen I don't know what you'd call influencers or something doing that, and I just don't get it. It's so unhelpful. It's so
unhelpful. They really shouldn't be doing that. I was not even aware of that, but just for anybody who has seen those videos, I just want to clarify that is illegal. Even if it is a prescription, you would still be fined in the same way that you would be fined if you were using illicit medication. So please don't follow that guidance or advice or suggestion, and use it exactly how the doctor has informed you to use your medication. So Sarah, I just want to put that out there because I wasn't even aware that this was a thing, and I think these are one of the things that do disturb me sometimes when, we're trying to advocate for medication. However, we're in a position where people are using it not necessarily the way it's prescribed. Let's put it like that. So
I agree with you, and I think that's really, really unhelpful. Actually, it's really unhelpful to people that really, really need this. And actually, if we're going to get doctors on our side, the last thing we need is to be putting out any content of people rolling big joints and smoking them and sharing them on YouTube or whatever. I just think it's so unhelpful, because no doctor in the country, in the world, who sees that is going to think it's medicine. They just think it's people who are wanting to smoke recreational cannabis. I'm not saying they are, but that's what it looks like. It's just people who are like they're using the medical market to fulfill a recreational need. And I think that is really disgraceful when there's a lot of people out there in huge amounts of need who are medical patients who are happy to use it as prescribed. And I think it really frightens me that those people do that and think that it's helpful. I don't know why they do it, but anyway, I completely agree with you. It's not helpful. And if we're actually going to build this market and this industry for everyone, then we need to make it accessible to everyone, not just a small amount of people who feel comfortable with smoking cannabis.
No, and I fully agree with you. Thank you, Hannah. Just one very quick question. What sort of advice would you give to, I suppose, in particular, parents who are, I suppose, two minds about trialing medical cannabis for their child for, let's say, epilepsy or any other condition that meets the criteria?
Well, I think a lot of it is the same as what I did now, is still research, is looking at the research, looking at how cannabis can work for your child. In the organisation, the company that I work for with Mike Barnes, Maple Tree Consultants, who are actually going to be bringing out a document very soon, hopefully in the next few months, around epilepsy, for example, and an introduction to medical cannabis for doctors. So but that will be available to everyone who wants it. So it'll have a full review of all the evidence base. It'll have a full review of all the the cannabinoids and how they work, for example, for epilepsy. And we're going to try and do a series of documents like that, which we can send to doctors, but also that parents and patients can have and download and give to their doctors and help with their understanding. So that's one thing that will be really interesting, hopefully, for patients, and especially for parents of patients with the epilepsy one we're bringing out. But also you have MedCan Family Foundation, which I helped set up with my friend Matt Hughes, who's also got a little boy with epilepsy. I would encourage every parent who is listening to this who's interested in using medicinal cannabis on prescription for epilepsy, autism or pain, to come to our website. There's loads of information on how it works, and unfortunately there's no prescribers in the private sector or in the NHS at the moment. That's been very, very, very upsetting and very sad, considering that the law was changed because of children. It's very sad that that demographic has been forgotten. It's because there's a big push against prescribing to paediatrics, and obviously it's a lot harder for paediatric doctors to come out and do this. I think it's a lot easier for adult doctors to, because adults can give informed consent, whereas children can't necessarily, especially if they're disabled. So I think that it is very challenging. So I would urge parents to join us. We will support and help educate them. We do events, and we're hopefully doing some events over the next year, sort of getting parents together, etc. Because I mean, really, that's what helped me, is finding other parents who have children with epilepsy, because we're all in the same boat. And whilst I know I'm very, very lucky at the moment. Alfred's doing incredibly well. The reality is that at any point he may not, and that means that I do live with a certain level of anxiety every day, which is why I fight for everyone else, because I think, I want it to be mainstream. I want it to, when my son is an adult and he, may either live with us or need to live in some sort of supported living, I want him to be able to access medicinal cannabis on prescription still, because that's what saved his life. So, we have such a long way to go still. We have got a long way, but we have such a long way to go until it's available, mainstream available medicine, so that doctors feel comfortable prescribing. So, the more parents we have together in the group, the better we will be at succeeding. I've always felt that, strength in numbers, collaboration is so important. So, definitely come to us and we'll support people.
Thank you so much, Hannah, for coming on and for sharing your incredible story. And most importantly, thank you for being brave and putting on that fight, because like you said, even though it was for your son, you have supported so many other thousands of people like myself to be able to access medical cannabis where conventional treatment has completely failed. So I definitely appreciate I apologize, my throat. I definitely appreciate, what I'm going to say, your struggle, because it was a struggle. And it sounds like it's still a bit of an uphill battle from time to time, but we're all going to work together and we're all going to support as many patients as we can. And for anybody who is interested in knowing more about MedCan, the links will be in the description area. And Hannah, thanks again for joining us, and goodbye, everybody. We look forward to seeing you next week when we discuss safeguarding adults and children.